Stand by to fall in, Polk County. This is today's veteran. Hello and welcome, and on behalf of everyone at the Polk County Office of Veteran Services, thanks for joining us. I'm your host, Tim Kirkhart, and on this installment of Today's Veteran, we chat with Joe Battle, Medical Center Director of the James A. Haley Veterans Hospital and Clinics in Tampa. Activated in 1972, the James A. Haley Veterans Hospital provides a full range of patient care services with state-of-the-art technology as well as education and research. Comprehensive health care is provided through primary care, tertiary care, and long-term care in the areas of medicine, surgery, psychiatry, physical medicine and rehabilitation, spinal cord injury, neurology, oncology, dentistry, geriatrics, and extended care. Mr. Battle, welcome to the show.
Thanks, Tim. I'm happy to be here.
Appreciate you coming back. It's been a couple years since we've had the pleasure of having you on the show, and you were new at that point. So can you give us an update on some of the major milestones that have been happening at James A. Haley?
Sure, Tim. I appreciate that. We're very excited that in the last month or so we've broken ground for a second Fisher House at the hospital for when families come in to stay at the hospital, when patients are in the hospital. We're going to have more room for them there at the facility if they can't drive back and forth. So we're very excited about that. That'll add 16 more suites that families can stay in, and our current Fisher House is one of the busiest in the country. Not in Polk County, but we also just broke ground on a new clinic for South Hillsborough County, down in the Big Bend area. So that's going on. And we're finally getting very excited about our new bed tower. The Army Corps of Engineers is running that for us, and right now they're anticipating a contract award in September or October. So we're very excited about that. And that will be putting in all private rooms at the hospital for our acute care wards for when our patients have to stay.
Great, great.
Yeah.
And what about Lake Wales? Is there plans?
Yeah, in Lake Wales, we're looking to, in the future, have a contract arrangement down there with someone. We don't know who that would be or anything like that, but when we get our final authorizations for that, we'll be looking to put a presence there. We're also looking to expand our Lakeland Clinic, which is, most people around here know, is pretty maxed out on space, and so we want to double the size of that clinic too. And so we're waiting on final authorizations for that, and when we get it, then we'll get started on redoing that clinic.
And will that probably be at the same location, or?
Well, it has to go through a contracting process, Tim, so I can't say that it would be there or not. It would just depend on what developers or who had an interest in bidding on the project, to tell you the truth.
Okay. No time frame on that at this point?
We've been waiting on these final authorizations since I've been here last time. This project got hung up in a general accounting office review, along with about 20-something other VA leases, and so we're still waiting for the final stuff on that to break loose. We're hoping there'll be any time.
How's the parking garage working out at James Haley?
Yeah, we have a parking garage there, and we were doing pretty good on parking till a few months ago, but we've had more people coming into the hospital, which is a good thing. And we also had to take out some parking due to the new Fisher House. So right now we've been experiencing a little bit of a parking crunch, but we're working on a plan to alleviate that here in the very, very near future. But right now it's a little tight.
Okay. Okay. We just had a new secretary appointed.
Yes, sir.
Are you familiar with him from his prior service or in the VA, or
Yeah.
what is his? I've got a quote here: "Every veteran who walks through our door should have a positive experience."
Right. Our new secretary is Dr. David Shulkin, and he actually was the Undersecretary for Health under the previous administration and was the only holdover from the previous administration to the current administration. And he was confirmed by the Senate 100 to zip. So he's very popular with both Republicans and Democrats, and enjoys bipartisan support. And so, he's familiar with VA because he had been in the VA for about 2.5 years before this. So we're happy that we have someone that understands the VA agency and system to help lead us.
And somebody that you don't have to train.
Somebody we don't have to get up to speed, but he's a very, very sharp individual.
So we've heard nothing but good things about the secretary and his vision and what he wants to do, and you would confirm that.
Yeah. Yeah, the secretary, he has a vision. And one, as you just stated, is he wants every veteran to have a great experience when they come to our facilities. And if they don't, then we didn't do as good a job as we should have done. And I 100% subscribe to that notion. Healthcare is not just quality healthcare; it's also how user-friendly we make it. And along that line, some of his priorities is, we have this choice program. And while that was approved 3 or 4 years ago as a result of the Phoenix issues that most people know about, that law was hastily passed and implemented, and it's not as user-friendly as we'd like it to be. So the Secretary's asked Congress to make that more user-friendly. And right now the program was supposed to end in August, but it's going to be extended. And then probably by fiscal year 2019, they hope to totally revamp the program and make it more user-friendly for veterans, that if it's inconvenient for them to come to the hospital or to get their care or something, it'll give them more options in getting care in the private community also.
I know that's a hot topic because, we, of course, see veterans all the time, and we get the questions all the time. Mm-hmm. What does this mean? I got billed for something that was referred by my primary care or whatever. So that is going to change or be tweaked.
Yeah, that's one of the issues with the program now. When we make a referral to the third-party administrator for the choice in our area, it's HealthNet. Then that's a relationship sort of between the patient and HealthNet, and we're not in the middle of that, and we actually think we should be in the middle of that, helping those veterans get those appointments, making sure they get to the right kind of doctor, and that sort of thing, and that and some of the billing has been some of the issues that veterans have to deal with. I do get calls about it on a daily basis, and when we do get those calls, we try to help those veterans as best we can.
Because that is a big topic.
It is a big topic.
The veterans.
And the thing is, we want veterans to get care when and where they need it. And I'm happy to say, though, out of the appointments that we offer veterans to go to choice, if we can't do it within 30 days and that sort of thing, over 80% of them turn that down and say, no, I'll wait on you guys. Because usually most of those appointments fall in a 45-day range for us if we can't. But what you should know is that 98% of all our appointments are done within 30 days anyway. So and like last month or so, we did between 180 and 90,000 appointments, and only 3,500 of those couldn't be done within 30 days. So we do pretty good overall.
Well, as a user of the healthcare system, the VA, I can only give you kudos, because last time I called, I had an appointment in 10 days, I believe. And I tell everybody, we tell everybody.
Good.
Tell us a little bit about one of the top priorities is to modernize the systems.
Yeah, the Secretary wants to make sure we're modernizing our systems and to make everything more user-friendly for veterans. So, some of the things we're doing at the hospital, we're putting in new CyberKnife for cancer care. We're putting in new TrueBeam linear accelerators, which is state-of-the-art. We recently put in a Da Vinci robotic surgery. We've got all kind of new equipment coming into the hospital. Some of the space stuff with the bed tower I mentioned, but also it's not just space, it's also systems. So the Secretary just announced a week or so ago that we're going to go to a new electronic medical record that's going to be provided by a private vendor, and they announced that it would be Cerner versus our current medical record, which we've had since the 80s and 90s. So even though we have a really good medical record, this will put us in with the same type systems that private hospitals are using.
Okay. Tell us a little bit about the priority for efficient use of resources.
Sure. Well, we hit a milestone at the hospital this year. Our budget at the hospital actually went over $1 billion when you add it all up. And so care for veterans in Central Florida, the government's certainly putting a lot of money into that. And we're being good stewards. We're using lean management in the hospital to make sure that we're good stewards of the taxpayer dollar and trying to make sure we get everything we can out of the dollars that we spend.
We're about out of time for this segment, but we have lots of other things we'd like to discuss. Can you stick around?
I'd be happy to.
The Louisville Slugger Warriors are a highly decorated national slow-pitch softball tournament team featuring U.S. military veterans and active duty personnel who have suffered service-connected physical and invisible wounds. We got a chance to talk to Lonnie Gaudette, a graduate of Auburndale High School and a member of the team.
What we have here is we have players from the National All-Star team. That's the best players selected from the teams, and they're going to play the Louisville Slugger Warriors in this game, which means a whole lot because the Louisville Slugger Warriors are such an inspiring team.
My ties to Polk County, I moved here in '99 from Louisiana and started high school at Auburndale Senior High. Graduated in 2003, played a little bit of baseball, did a little bit of wrestling. Stayed here till '09 when I joined the military. I went to Fort Benning for my initial basic training, and then I was stationed at Fort Carson in Colorado. I was deployed to Afghanistan in 2010. I stepped on a landmine in March of 2011 and became an amputee right below knee amputation. So I rehabbed in San Antonio through the CFI, which is the Center for the Intrepid. It's a great facility, awesome staff. They push hard. From day one out of the hospital, they had me doing battle ropes in a wheelchair. And then from there, it was keep moving forward. You know, it was just kind of get your ass in gear or you're not gonna go anywhere. Some guys don't ever go anywhere, and that's the downside of these kind of injuries, but you can either be defined by it or you can define it. And you take that choice. I made the choice to define my injury, and since then I've moved on with softball and now playing competitively with this traveling team of other veterans and amputees who are going around the country and, you know, giving it all we got to show people that, you know, if you want something bad enough, you'll find a way to accomplish it. I would have never considered myself a role model until, you know, kids coming up and saying, or not even kids, but adults coming up and saying, you know, oh, you inspired me to get out and do something because I've spent the last 3 years as an amputee from diabetes, and I just felt that there was nothing else to do. And I see you guys out here running around playing softball and diving and everything, and you know, maybe I should get up and start getting motivated. And it's awesome to see what just a positive attitude and a little bit of reinforcement in the fact of you can do more with your situation. Having Louisville Slugger as a sponsor is a privilege. As a kid growing up, what did you swing? Wooden Louisville Slugger bat. Everybody knows the brand, so as a kid growing up, that was the coolest thing. You know, if you had a Slugger bat, you were a baseball player. And now I play for a team that's sponsored by something I loved as a kid. So to me, it's a privilege to be able to enjoy somebody willing to give us the ability to go out and do what we love. And they're doing it with just as much passion as our fans. They love the fact that we're willing to push, and they're pushing us to push their label, their brand. We all have that same sense of drive, determination, refuse to quit. That's why we made it through our rehab, and it's why we're doing what we do. And when we're out here, we don't have to talk about it. We get to just play. Everybody else can look at our injuries and say what they want to, but we know what we're capable of, and they can just sit in awe and watch what happens. This is fireworks. And we want to show people that we are just a team. We're not amputees. We're not guys with visible wounds. We want to just show people that we can still play and not be looked at as, you know, oh, well, maybe we should take it a little easy on, because we're not going to take it easy on you.
Welcome back to today's Veteran. I'm your host, Tim Kirkhart. Joe Battle, Medical Center Director of James A. Haley Veterans Hospital and Clinics in Tampa, joins us in studio as we continue our conversation about veterans health care through the James A. Haley Veterans Hospital under the guidance of Mr. Battle. Mr. Battle, welcome to the show.
Thanks, Tim. I'm happy to be here.
We were talking about, excuse me, some of the priorities, and one is improving timeliness of service. Can you tell us something about that?
Sure. One of the things we have is we want to make sure veterans get the care right away. And we've implemented same-day services at the hospital. In fact, we were one of the first VAs to do that. But if someone has a need or calls in, you know, we're going to start working that need that day. Now, that may be an appointment. We may tell you to come to the ED. It may be a prescription refill. It may be responding to you with our online service. You know, veterans can sign up for My Healthy Vet, and we can communicate electronically. But we're going to start working that veteran's needs the day they call in.
Okay. Tell us a little bit about My Healthy Vet and how that works.
Well, it's a great system. It allows veterans to access their providers and access the VA electronically through the internet. Anybody that's enrolled in the VA can sign up for it. And once you do, then you have access to your providers. You can get into your medical record and look at parts of your medical record. You can make your prescription refill request. You can talk to your provider. There's lots of things you can do. You can request other services. Many things you can do with My Healthy Vet that makes it easier for veterans to access us and get what they need. So we encourage everybody to do it.
My Healthy Vet is another fabulous program.
Yeah, we're very excited about it and very happy we're able to provide that.
With that in mind, and this is not on the agenda, a lot of veterans now are, well, they're in the benefits section, which is not health care.
Right.
But My Healthy Vet ties into that also. When they file a claim for benefits, of course, the VA encourages e-benefits.
Yes.
And then they can follow up on My Healthy Vet.
Yes.
And I've had nothing but good things said about that.
Yes.
Except sometimes they will be able to access things that I, as a veteran service officer, am not able to see, especially
Right.
through health care.
Yes.
So is that system working? I mean, I know you don't do benefits, but
Right.
But the My Healthy Vet that kind of ties into it.
Well, yeah, the e-claim process, while as you say is not my expertise, the veterans that are able to get their claims through that process, it speeds it up dramatically.
One other thing, and again, I don't think it's through you, it's the C&P examination.
Yes.
Are the veterans able to call in and have a C&P scheduled on their own, or is that in your area?
Yeah, that is in my area. Okay. We do C&P exams for the VBA.
Okay.
And what happens is the VBA will send us a veteran's claim and tell us what things they want us to medically evaluate for that veteran. And then we will call that veteran and set up an appointment that's convenient for them and get them in and try to get those appointments done. Now, what you should know is we view that very important at the hospital because that's people's livelihoods in a lot of cases. And so we try to get those things done and turned around as fast as possible. And the last numbers I looked at on that a week or two ago, on average, we were turning those exams around in 19 days.
Tremendous.
So now some take longer. If people have like 20-something different evaluations, it's going to take longer than somebody that has one or two. But on average, it's 19 days.
Great.
So
that's good to hear.
yeah, we pay particular attention to that.
Well, let's move on to the RN Contact Center. Tell us about that.
Yeah, that's something new that we're starting up to try to, again, provide veterans access. If a veteran has a question about their prescriptions or how to take a medicine or wants to talk to a nurse about some issue, we have a place where they can call in and hit number 3 on our phone tree, and on Monday through Friday, and they'll get to that RN call center and they can ask them questions about their care and what's going on with them, and those nurses will give them some advice.
When we talked 2 years ago, there were some issues with the phone system.
Yeah.
Not being answered or taking forever. What's happening with that? What's an update?
I appreciate you saying that. We've made some improvements there, like starting the RN call center was one of those things to try to make sure that people get to talk to someone when they need to. I won't tell you we've got that fixed yet. We're still working on it. We'll fix one area and then another one will pop up sometimes. But it's something we pay attention to daily on. If we're getting complaints about phones not being answered or something, we react to those daily and try to straighten them out.
Tell us about suicide prevention program.
Oh, I'm glad you mentioned that because that's one of the Secretary's top priorities. And he has set a goal of 0 suicides. And I think that's a noble goal, and it's going to be difficult to achieve, but we're going to work on it. Now, here's the thing people have to know, though. This is where it takes a village, because out of the 20 suicides a day that happen in this country to veterans, on average, only 6 of those people are in the VA system, 14 are not. And out of those 6 in the VA system, usually a couple of them are, 2 or 3 of them are not in our mental health program. And so what we encourage everybody to do, if you're having any kind of issues, despair, whatever, crisis, please come see us. And it doesn't matter whether you're enrolled or not, come see us. We'll help you.
If somebody comes in and goes to the mental health department, are they going to be seen right then and there? If it's a suicidal?
Yeah, oh, absolutely. If someone's in crisis or whatnot, we will see you right then and there. Actually, on substance abuse at the hospital, we have walk-in clinic for that now. And so we're doing more and more with that, our mental health, to make those services accessible to our veterans.
Okay. How about space allocated for mental health patients? Is that an issue, or?
Well, one of the things we're doing is, like, at every one of our CBOCs, we want to make sure we have mental health providers, and we're always wanting to add more people out in the CBOC area. So those are things we're doing. We're also using more telehealth now to make sure veterans get what they need. Some mental health now can be done telehealth for specialized programs where maybe a veteran wouldn't have to come all the way into Haley. So we're very excited about that.
Tell us about telehealth and what exactly that means.
Sure. Telehealth is where we're able to do medical care with a provider on one end of a television screen and the veteran on the other end of the television screen. And we're doing more and more care that way. Some specialty care, mental health care, even primary care can be done that way. And so we're expanding that to make sure veterans don't have to travel as far unless they just absolutely have to come to the hospital to make it easier for them. So we're standing that up with more and more specialties and our mental health to provide that service.
Tell us, what is a patient aligned care team? What does that mean?
Well, we actually get visited a lot from different organizations around the country and the world come in to see that. And we run our primary care on a PAC program, which includes a doctor, our RN, an LPN, and a clerk. That's your care team in the PAC when primary care. And then they will bring whatever other forces to bear, whether that be a pharmacist or a social worker, dietitian, or whatever need, that augments that. And so that they manage your care. And we do that for all our patients, and that way we make sure they have great continuity of care and that all their needs are met.
We are about out of time. Is there anything else you want to tell our viewing audience before we end?
Well, I'd just like to put a plug in for those veterans that have hepatitis C. We are aggressively trying to treat every veteran that has hepatitis C because we have the drugs to do that. And unlike many things, we can cure hepatitis C in about 96 to 98% of the cases. And you don't have many things where there is a cure. And so veterans who have hep C, we want to take care of you and treat you. If you got it, come see us because we want to eradicate that for you.
Mr. Battle, thank you for coming in again. Appreciate it.
Thank you. Thanks for having me.
For more information about James A. Haley Veterans Hospital and Clinics in Tampa, look them up on the web at www.tampa.va.gov or give them a call at 813-972-2000. That's going to do it for this edition of Today's Veteran. I want to thank our guest today, Joe Battle, Medical Center Director of the James A. Haley Veterans Hospital and Clinics. Most of all, I want to thank you for joining us. Remember, for help and information regarding claims, benefits, and services available to veterans and their families, call the Polk County Veterans Service Office at 863-534-5220 or log on to the Polk County website at polk-county.net. I'm your host, Tim Kirkhart, and we'll see you next month.